Hi, Dr. Brent Reynolds here. Today I want to talk about something called heart math that we use within our brain core neurofeedback software. And what heart math does is help us to train our hearts and our brains to reduce stress. So what we're training is the what's called the heart rate variability, or HRV. What that is our hearts have a normal rhythm, right? Your heart's beating from, like, let's say 72 beats per minute. Well, actually, to maintain a smooth heart rhythm, there's a little bit of variability between the heartbeats. So, in other words, it's like you're driving down the expressway and you're maintaining a speed of 65 miles per hour. And to maintain a smooth 65, sometimes you may have to speed up a little bit smoothly to maintain that if you get too slow. Or if you're going a little bit too fast, you come back down to maintain that rate. If you do, that maintains a smooth heart rate, and that is associated with a reduced stress response. And our brains send signals to the heart, and the heart sends signals back to the brain. As we get older, our heart rate variability declines, so it's harder for us to maintain a smooth rhythm. When we're stressed, we have an abnormal heart rate. We can have an abnormal heart rate variability, either short-term stress or long-term stress. So having this helps us to reduce stress in our systems, to reduce blood pressure changes, to keep our blood pressure in check, and reduce our risk of stroke and heart disease. When we have even negative thoughts, our heart rate variability becomes sort of scattered. So imagine you're driving down the road trying to maintain the 65 miles per hour, and you become stressed. Now you've sped up too much, you have to suddenly stop, and there's a jerkiness to get back to 65, and then you've slowed down, so you have to get back. So there's this irregular rhythm going on in the heart, in the nervous system, in the brain, in our bodies in general. And that's really not good. So what we do is with this technology, is we measure the pulse, the heart rhythm, and heart rate variability. And when we produce positive emotions, we think positive emotions, and we have a good heart-brain connection, our heart rate variability becomes decreased or improved, and the heart rhythm becomes smoother, our breathing is good, our stress response comes down. We say we are within coherence. There is coherence happening. And that's what the program does, is it gives us real-time feedback to how we're doing. So, thinking positive and, thinking about loved ones and being, thinking loving thoughts does this. And you can, it's great to do all day long, which helps to reduce your heart rate variability, or to breathe and things like that help to reduce the stress response. And that's great. This actually gives you feedback to whether or not you're doing it, optimally or not. So maybe at first you're not very good at it, and then over time you can actually improve this and build this up like a muscle. So you can actually build up the stress response to reduce the stress response in your brain and your heart. So if you're a heart patient, or you have a history of hypertension or high blood pressure, this is a great program to use. Even if you don't do the neurofeedback, which is the training of the brain waves, just to improve your heart rate variability is great. So talk to your cardiologist about doing this type of therapy. So right now what I want to do is I'm hooked up with the clip on my earlobe, and I'm playing a game, and I'm going to turn the camera around here to see. And what you're seeing here is a hot air balloon flying above the mountains. And when I'm in coherence, or when I'm thinking good thoughts and my breathing is in line and I'm reducing my heart rate variability, the balloon goes upward. Let's see if we can get that to do that. So And there we go. That's the balloon ascending above to a greater height. And I was within coherence. I was, thinking positive thoughts and thinking about, just loving thoughts about my kids, about my family, and things like that, and breathing and training myself to do that. So this is great technology. If you have any questions, please visit our website, newlifechiropractic.com, or call our office, and we'll see you then. Take care.
Hi there. Today we're talking about anxiety. Anxiety can have several forms, right? Sometimes it's a classic panic attack, worry. Sometimes it's rumination where you just can't let go of certain thoughts. Sometimes anxiety presents as when you lay your head on the pillow at night and you just can't stop thinking about all the things you could have, should have, would have done. So it's different for everybody, but anxiety plays a major role in our health. And if you suffer from anxiety, you don't need to suffer anymore. There are solutions that are available. Today I'll be talking about a couple of solutions that I have found to be very helpful for those patients who are suffering from anxiety. One of the things that we use here is we use neurofeedback. And what I typically see on a QEEG, which is basically a measurement of your brainwave patterns, is that we can see that the brain is stuck in this really fast high gear. And when it's stuck in this really fast high gear, patients are coming in saying to me, I might be able to fall asleep, but I certainly can't stay asleep. Sometimes I can't even fall asleep. I constantly am thinking of things, I'm worrying, I have panic attacks, I can't let go. Sometimes I have some OCD symptoms. I just feel like I have to do things a certain way. I can't let things go. And sometimes I feel like I have focus and memory issues. I think it's because I'm thinking about so many things at once. It's hard to really focus on the task at hand, so I might just be all over the place. Those are classic signs of having an over-aroused brain. And so to deal with that, you could do neurofeedback, which would train your brain to be in a lower gear, a more healthy gear, so that you don't have these kinds of ruminations that are going on. You can also consider something like meditation. Meditation is a tool that we use to bring our brain down into the lower gears. When you're doing meditation, you can do guided meditations, you can just sit by yourself and breathe. You can do a meditation where you're just sitting there and breathing in and out and just focusing on your breath. That will help your brain move into the lower gear. If you need some help with meditations and you would prefer someone telling you what to do and how to meditate, I do offer meditations on my Healing Boobies site, which we will create a link below for that. There is help out there. You don't need to suffer in this way. There is a solution, and BrainCore can help you get you where you want to go. Meditation can help you get into those lower gears and feel better. Thanks a lot for tuning in, and we'll see you again next time. Bye. Hi everybody. Today we're talking about teenage anxiety. There are a lot of demands on teenagers nowadays. The academics, the athletics, the social pressures, and some kids are able to manage better than others, just like certain adults can manage better than others. And today I wanted to talk specifically about neurofeedback and how neurofeedback can help with anxiety. You know, I've talked to you before about how the brain is supposed to shift gears, right? Speed up to learn something new, slow down when we want it to go to sleep, and then stay in kind of an idle gear when we're doing things that are routine. When kids get stuck in this anxiety, what happens is that they get stuck in these higher gears. It's called beta waves, and this is why they may not sleep as well as they should, or why they just have that constant angst. And this is really, really important to address. I hear more and more cases of teenagers finding other ways to deal with their anxiety, whether it be drugs, alcohol, cutting. I mean, I've heard so many challenges, and this is a non-invasive way to really help your kids get the help that they need. This is a tool that we can use. Neurofeedback helps to train their brain to have a different pattern. So instead of being revved up, we're rewarding the brain every time it slows down. And what greater gift can you give your kids but the ability to self-regulate themselves, right? You know, if this prolongs, then they find other ways to make themselves feel better, and it's not always the best choices. And we know that the prefrontal cortex, which is the front of the brain, really develops while we're in our teenagehood, you know? And so without that development, they're not able to inhibit their brain the way it should. So in other words, they might make impulsive decisions. And this impulsivity can really create lots of challenges for the whole family dynamic. So my suggestion is, if you have a child that's struggling with anxiety, don't wait for these other things to pop up. Address it now, address it at the source, and get a QEEG so that we can see if that's what's going on with them. Thanks for listening. Talk soon. Bye. Hi there. Today we're here to talk to a patient's mom of ours who wanted to speak specifically about their experience with brain core therapy and their child who had suffered with anxiety. So I'll turn it over to you.
Okay.
What made you bring your daughter here?
Well, it started back in 6th grade.
Mm-hmm.
My daughter was not feeling well, stomach cramps, um, uh, bad enough where we took her to the emergency room.
Okay.
She was about 11 or 12 at the time, and they did a lot of invasive procedures, and it scared her. So from that point on, it seemed that she became anxious very slowly. I noticed asking questions and worrying, am I going to throw up? Am I going to be sick? And it was a lot of questions. We took her to a therapist, but fast forward to 8th grade.
And I'm assuming they didn't find anything wrong, quote unquote.
No,
wrong.
they didn't find anything medically wrong with
Okay.
her. And in 8th grade, it kind of manifested itself where one day she was like, I can't go to school. She was laying in bed, very, very anxious. And what I did was I called a therapist right away, called a psychiatrist right away, got her in. So at this point, she wasn't going to school for a couple of days. Got her in, worked with a therapist 3 times a week.
Okay.
Took her, she put her on, the psychiatrist put her on medication. And all this stuff works very slowly. So it was a slow go, but we finally got her after a couple of months to get back into school. And she was doing well. But still there was something there. She was anxious. about certain things, and those things, when you're anxious, it has like a ripple effect on everything. Your family, your social life, things you want to do and you're afraid to do them.
Right.
Because of the anxiety and the fear of even leaving your house because you're afraid you're not going to feel well. You're afraid that you're out of your comfort zone. So I happened to go to a party, and my friend's friend had suggested brain core. She had suggested it for about a year, but I was doing a bunch of other stuff with Megan, so I said, let me kind of finish this out. And then what I started to see was that she was better, but there was kind of something missing. She wasn't completely free of her anxiety. Now, I don't think anybody's completely free, but I needed her at 16, 17, she's in 11th grade now, to start making decisions for her life, relationships, college, going away to college, being afraid to go away to college. So I didn't want these fears to make decisions for her.
Right.
And that was my main goal at this age with her.
Yeah, that's huge.
So I brought her here, and we started probably in September. Probably after about the 6th visit, we saw some improvement, and the improvement was calmer, happier, more confident.
Excellent.
And she even noticed it, you know. The things that made her fearful were not making her anxious anymore. She noticed them, and then they just didn't get her to the level where she was anxious.
Right.
So I happened to ask Megan yesterday, what would you say? You know, I'm going tomorrow to do a testimony. What would you say was your best experience here? And she said she loved coming here. The people are so pleasant.
Aw, that's so nice.
She was very comfortable. Anybody who has a child or a teenager, Megan's a teenager, but a young child too, the therapy is extremely easy for them. They enjoy it. I never had a problem bringing her here.
There's no,
she
there's no pulling her.
enjoyed coming here.
Good. That's so helpful.
She used to say she'd come back, that you'd put a blanket on her, and she'd just be so happy.
That's great.
Because she knew, she could see that what she said is her anxiety melted away without her even realizing it. And then she would look back and say, you know what? She would say to me, I used to get so fearful about this, and now I'm doing this all the time, and I'm not worried.
That's amazing.
So, you know.
So you would recommend Brain Core to others?
I would
assuming?
highly recommend Brain Core to, and again, I can only speak to the anxiety that my
Right.
daughter had. And, you know, teenagers go through a lot of different things, especially once they hit 13, females, hormones, and you have to kind of differentiate between, is this normal teenage behavior, or is this something else?
Right.
And it, you know, it was definitely something else,
And luckily, you know, what we do is we do the QEEG, the brain map. So
Right,
if
right.
we're not sure, is this just typical behavior? Or
Right.
is this actually neurological dysregulation
right,
that's associated with anxiety? And
Right.
that's what your daughter had, is we had that imbalance on her brain map that was
Right.
an objective finding that when I looked at the map, I was able to say that will cause anxiety.
right.
So once that normalized is really when she started getting all the results.
Right. Like I said, it was about
So-
the 6th visit,
Mhm.
but then as we just went on, you know, she's more social,
Mhm.
she's more talkative,
Mhm.
she's enjoying things more.
Mhm.
Something that always would make her a little nervous is gym,
Mhm.
because when you're anxious, the last thing you want to do is run around,
Mhm.
have your heart rate go
Even
up,
faster.
beating faster. That makes you nervous, because
Right.
now that feels like
Right.
you're having anxiety. So now she loves gym, she's playing basketball,
And she's,
social, going out more.
so that ripple effect that you had seen, you're seeing in many areas that this is
Oh yeah,
improved
many
your
of the
life.
eating, You know, usually anxious, especially with the anxiety she had, afraid of getting sick. So let me, if I feel like I might throw up, I'm worried about getting sick, so let me not eat.
Right.
Because if I don't eat, I don't throw up.
Mm.
Which is not true.
Right.
But again, something that would be fearful for her.
Right.
Going out to a restaurant. It just rippled out, and you feel bad as a parent because now your child is kind of in the house, not being social, kind of in a shell.
Right.
And she was a little bit of a shy kid to begin with, but this made her even more, in a shell.
Okay.
So we can just see a complete, my husband and I both can see a complete, I'm going to say 100% improvement. She says to me, I have no anxiety.
I love that.
Now she's on medication, but we've been able to lower her quite a bit.
Uh-huh. That's great. And she had been on it the whole time, so
she's been on it the whole time, with school and everything, and what she went through. I don't want to take her off the medication, but it's always good to kind of lower them.
Absolutely. You know, there's a time and a place for everything, and if we can get her to a point where, you know, she can take the medication still and feel great with the neurofeedback as the complement,
right?
That's excellent.
It's just, I would recommend it to anybody who would ever want to talk to me about it. If you ever wanted to have anybody speak to me about it, I would.
Well, thank you.
Definitely. I've recommended many people to come here. It's just a game changer.
Great.
Really.
Well, thank you so much for taking the time to do this with me today.
No problem.
I appreciate it, because really getting the word out from other families
Right.
who've been there, done that is just such
Right.
a powerful message. So thank you so
You're
much.
welcome.
Thanks for tuning in. Okay, so today I am sitting here with Mel Glazer, and we're just going to have a little discussion on what some of your experiences have been. And the first thing I'd like you to tell us is what your professional background is.
My professional background is actually in three different areas. Firstly, I was a vice president of sales for cosmetics for Chanel.
Okay.
That would be the perfume and cosmetic business. Then I was also the co-writer of recordings by Etta James, Robert Plant, Elvis Presley. If you take the time to Google the top 10 songs of Robert Plant, you'll find that I co-wrote number 6.
I love it.
I want to put that in.
Yeah, that's
Your mom
awesome.
said you cried in your sleep last night. And also education. I recently received an honorary doctorate of humane letters from Five Towns College.
Wow, amazing.
So it's 3 distinct areas.
Yes, amazing. So tell me, Mel, what brought you in here?
Pain.
Yes. What kind of pain?
Oh, pain. Or terrible pain. I mean, when I think of the pain, I mean, it wasn't just one area in all the time that I've been coming here.
Right.
It's been, it could be in 4 or 5 different areas.
Places. And what had you tried before you came?
Everything, I suppose, that one would think of, you know, meaning going to regular doctors and trying different things on my own based upon things that I read or whatever.
Right.
But coming here has been a new experience and would be for anyone, I believe. I shouldn't talk for everyone. But I feel that you and Dr. Reynolds are so distinct, so different from the ordinary chiropractor. There's so much more of the two of you to offer a patient, and I don't drive from Great Neck to Smithtown because you know, it's fun.
Right.
So
We need a satellite office out there for you, right?
No, you don't. This is well worth. As one grows older, you know, time becomes more important, and I don't regret a moment of the time that it takes me to come here and go back.
Great. So I'm glad you have found some relief, it sounds like.
Well, I found a lot of relief.
Great.
I mean, I could walk in at times. I would walk in with bent over, you know, and I mean, really bent over and couldn't stand up straight, and you know, and go out perfectly like a soldier.
Well,
At attention.
great. Well, I can say from myself and from Dr. Reynolds too, we're honored to be able to have helped you.
Thank you.
Thank you for doing this.
Thank you.
Bye now. Hi there. Today we're talking about neurofeedback and neuropathy. A recent study came out of MD Anderson Cancer Center, and they found a dramatic reduction in the symptoms of neuropathy, which is pain and tingling in the hands and or feet, specifically after chemotherapy treatments. This is something that of course is near and dear to my heart based on my own personal history. And there's not that many choices out there for you when you've had chemotherapy and you start to suffer with the neuropathy. There are a few medications, but they don't help everybody. And for those people who haven't responded to medications, or if medications are contraindicated, then this is a possible solution. You know, being a survivor myself, of course we're happy when the beast has been slayed, but being left with the symptoms that wreak havoc on your body and your life after chemotherapy treatment is something that is a big struggle with many survivors. So if you are a survivor and you suffer with this pain and numbness in your hands and your feet and nothing has been able to help you, then please give us a call and we will be able to do a brain map, which is called a QEEG, to see if indeed we might be able to help you. And if you know somebody who's a survivor who is suffering with this, please pass along this information. Thank you so much. Hope you guys have a fabulous day. Bye now. Hi everyone, please stay tuned till the end. I have a very special announcement that I'll be making. This month in Time Magazine, an article was done on specific kinds of breast cancer chemotherapy treatments and a higher incidence of suffering from chemobrain. Chemobrain is a condition that affects quite a few survivors, and it's characterized by having challenges as memory deficits, and severe cognitive decline. During my treatment, I was lucky enough to have access to neurofeedback throughout the course of my treatment and post-treatment. And what I would do is I would do sporadic QEEGs during my treatment so I could really know objectively how the chemotherapy was affecting my brain. At that point, I continued to do neurofeedback treatments during treatment and post-treatment, and I'm very happy to say that I did not suffer with chemobrain, and I attribute this to neurofeedback. So if anybody knows women out there who are breast cancer survivors who have had the experience of having chemotherapy and are suffering, please pass along this video to them because it can be very, very helpful. For the announcement, when I was diagnosed 3 years ago, it was definitely, there was a lot I had to go through, surgeries and treatments. And when I had completed all my treatments, I expected to just revert back to this old person that I had been prior to. And the Western medical system does a great job of dealing with cancer symptoms for your physical body, but they don't really address the emotional scars that breast cancer can leave behind. And when knowing that what we know and working with people on the mind-body connection, this was something that I needed to explore for myself. There are certain emotions, there are certain conditions that are linked with having challenges emotionally. So, for example, it can be as simple as a Wall Street executive who has a heart attack and they go, oh, well, it was because of the stress. Well, with breast cancer, there are certain emotions that are more toxic for breast cancer survivors. So through my own journey, I found tools that were really helpful in getting me to be like I used to be, to feel as good as I had felt before this whole experience. So I created a 6-part series, a video series for women to really walk them through the journey of how to heal these emotional scars and how to feel better, not just mentally, but physically and emotionally, really on a whole spiritual level. So The course is called healingboobies.com. I would love for you to come over and check out the site, and then check out our Facebook page is also Healing Boobies. Twitter I'm on Pinterest also. And please share this information for any women that you know that have, gone through this experience and are still longing to be the people that they were prior to the Big C. Thank you so much for everything. I appreciate all your support. Much love. Bye-bye now. Imagine if you could connect to who you were before the Big C diagnosis. Wouldn't it be amazing to tap into the way you used to feel? Your feminism, your vavoom, your life, the way it was. I've been there. I am you. Let's embark on this journey towards healing all parts of you, towards creating the life you deserve and were meant to live. Sign up now to get instant access to the beginning of your transformation. You will get better. You can get your happy back. Hey ladies, just wanted to let you know that the Healing Boobies meditations are now available for purchase. There are a variety of titles available, including some that are very specific with those of us who've been through the big C, things like fear of reoccurrence and anxiety before a checkup, and then some generalized one like being able to get a good night's sleep and decreasing our anxiety and forgiving others. So I hope you enjoy them. Just a little background about meditation. Meditation's been around for thousands of years, and meditation is our way to defrag our computer, ladies. So really what we do is we're able to shut down and bring our brain into a certain brainwave pattern that allows us to heal. So it's super important. The meditations can be purchased with or without background music. And in the meditation, in the beginning, I bring you into a comfortable position to begin your meditation. If for some reason how I am guiding you in the position that I am putting you in is not comfortable, then please, the most important thing is to make yourself comfortable. So just get into a comfortable position, because if your body's in pain, it's going to be difficult to get into the meditation. That being said, if there's a day that you can't get comfortable no matter what, still meditate. It can help. I'm really looking forward to this, and I'm hoping you ladies really, really love the meditations. Thanks so much. Talk to you soon. Bye now.